Was businessmen who were, traveling around the world, and they carried things that they shouldn't have carried. And then it's affecting the poor regions, so they're the ones who are still suffering.
Our reasoning for this finding is that people of higher social status are more affected just because they have these diverse networks, and even if it's not widespread, it's possible that they get infected.
Hello and welcome, Jana, to Ph.D. hardtalk. Thank you so much for agreeing to have a conversation with me in regards to your research. Could you please introduce yourself in terms of the year that you're in, and then take us through your research as well?
Yeah, sure. Thank you very much for having me. I'm very excited to talk about my research today. My name is Jana Berkessel. I'm a Ph.D. candidate at the University of Mannheim in Germany. And I generally study cross-cultural social and personality psychology. That means that we look at social processes and processes related to personality, and look at how they differ with regard to the existing or surrounding culture people are living in, and how this culture can affect social processes. I'm in my third year. So in Germany, that's pretty close to the finish line, I would say. So this is why this project is already finished, and I'm very excited to be talking about it today.
Well, thank you so much. So in terms of your research then, how did you identify the research gap?
So this is actually quite I think a cool story about this research project, because my partner is also a psychology researcher. He's a postdoc at the same university. And during the first lockdown in Germany, we were just having lunch, and we discussed what we know about how pandemics spread and what we think about it from a psychological perspective. And in some of my other projects, I also study social class and social status. So how does that affect your well-being, your behavior, and so on. And from social psychology, we know that social status is a very good predictor, or has a very strong effect on our behavior. And we also know that people of higher social status, they are more mobile, they travel more, they have more diverse networks, they meet more people, not necessarily more, but more heterogeneous people. And we just had this idea during lunch, wouldn't that mean that at the beginning of pandemics, people of higher social status be at the center of the spread, because still everything is still normal, there are no restrictions, so everybody still travels, they have more money to travel, they have more jobs where they travel more. And then we started looking into the data to check whether we were on the right path, and we had a good idea, and we actually were able to find the same pattern in the data. So that was actually, I think, a pretty cool story to this project.
That is amazing. I need to date a postdoc as well, because
I can recommend it.
That is amazing. Wow. Just on the coffee table, literally. And here we are.
Yeah.
Wow. Amazing. Right. So in terms of, from a psychological perspective then, if we take away the upper class or middle class in that sense, and we look at the rest of the world, how are they affected when it comes to a pandemic, be it swine flu, COVID-19, HIV or AIDS in that sense? Why is it so slow to get to them?
You mean to the upper class or everybody else?
Everybody else.
Okay, so that's a good question. So I think we only checked it in COVID-19 in the Spanish flu, so I can't really say a lot about all the other epidemics or pandemics. But for what we hypothesize, or what our reasoning for this finding is, that people of higher social status are at the beginning, the virus is not very widespread. So now, or even 1.5 years ago, after it has been around for a few weeks, it spreads basically everywhere. But at the beginning, for example, it was only in China at the very beginning. So only people who travel to China, or who have contact to people who travel to China, will be able to get the virus at all. So you really had to have very diverse networks. You had to be in Germany, for example, the first case was in a company that had a visitor from their partner company in China. So it was really like businessmen who were the first ones to get infected. So if a virus is not widespread, you have to have very like widespread networks to even be able to kind of get the virus. But once it's spread everywhere, everybody gets it. And this is also kind of a, I think, dramatic perspective from this that we can take away from the studies, that at the beginning, it's rather like the upper class people who carry it to your country and to kind of spread it in the community. But once it's there, it hits the poorest the hardest. So this is, this is something we find. And this is, this is also how I would explain why at the beginning people of higher social class are more affected, just because they have these diverse networks. And even if it's not widespread, it's possible that they get infected. And I think there's also some studies on HIV that was pretty similar, but like we didn't run a study on that, but that it's still kind of rampant in like now different like classes or groups of society. And at the beginning, it was really like an upper class thing, but it's, so I think that's very interesting to see that it's not only in like these, I mean, the COVID-19 and the Spanish flu are both like transmittable diseases just by personal contact. If you talk to someone or touch someone, you get infected, but HIV is very different to that. So it's interesting to see that even there in like a different kind of transmission, you find a very similar pattern.
I mean, that is impeccable. I mean, going back to the AIDS or HIV, I think it was businessmen who were, traveling around the world, and they carried things that they shouldn't have carried, or maybe they wanted to, we never know, in that sense. And then it's affecting the poor regions in terms of, the third world. They're the ones who are still suffering from such. We had Ebola, again, it was the third world, and then it was the Zika virus or something like that. Zika, so it's quite interesting that there is a pattern. So going back to COVID-19 then, in terms of Germany, we've seen that it's a businessman that's brought it back in. In terms of future to mitigate such risk, what is your proposal?
It's a good question. I think at least at the beginning of the pandemic, it was very hard to track cases, and there was like very limited testing. Now it's very easy to get tested, but at the beginning it was very there was just very limited testing, very limited resources, limited masks, everything, because nobody was prepared. Or I mean, we were somewhat prepared, but not in this dimension. And like what we take away from the study is that maybe at the beginning of pandemics, it makes sense to monitor richer areas more, and to have like this stricter outbreak monitoring. But this doesn't mean, of course, that we shouldn't monitor poorer regions too. It's very important to have this a wide coverage. But at the very beginning, and this is like an important part of this reasoning, is that while there are still no restrictions, it might be, for example, airports might be especially interesting to monitor. Or in Europe, at the beginning of the pandemic, a lot of cases were being able to be tracked back to the high upscale skiing resort in Ischgl. So there was also that would be something to take away. Maybe if there's limited testing capacities, maybe also check in like these kind of upper class surroundings.
So in terms of upper class, as we know, in terms of here in England, it's quite difficult to, those who have money, they control the world, as people say. How do we then educate them in terms of the seriousness of, any pandemic that may occur in the future or currently with COVID-19? To come up with such a piece of work is amazing, but to educate the upper class, how does one do that? Have you got a plan, an action plan, or is it just still pending?
Yeah, it's a good question. I think I would say it's probably still pending, but it's also hard to say, because I wouldn't say that it's because people didn't take it seriously, because the phase we're looking at here, where it spread primarily among people of higher social class, it was nobody was aware that we're in a pandemic yet. So it's not that after we knew it that they didn't follow the rules or something, because that's actually the opposite. Because people who have more money, who are more educated, who have like jobs that allow them to stay in their home office and so on, that they are actually more better able to follow COVID-19 restrictions and be safe from the virus. So this is, I think it's not about teaching people the importance of pandemics, because I would say that that's not what we find here, but it's rather that just their general behavior outside of pandemics has this effect that they are more likely to transmit a virus. So I don't know if there's anything that we can take away as how to educate people about it, but I will have to think about it. Maybe I will come up with a good idea.
No, I mean, from my perspective, when we heard about China, I feel we should have started reacting. Because we know how many, for example, we know how many planes are leaving the UK and they're going to China. We know how many planes stop off in Singapore. So all those people, there's a lot of contact there. So if we realize that there's something that's triggered elsewhere, we need to be shutting down immediately, because we don't know whether it's coming back. So that's why I'm asking the question to say, is it a matter of education when it comes to policy writers? Is it the upper class and middle class that needs to be educated? Because there's a lack of responsibility somewhere, not to point fingers. And
I would say
that's something that you've identified, or am I just going out there? That's a good point. I think, as I said, I don't think I would kind of say that people of upper or people who had enough money to still travel and so on, that they did it because they weren't educated or something, because we just didn't know what it meant to be in a pandemic. And it was also unclear. It wasn't a pandemic until I think March. So it was already spreading, but it wasn't the WHO hadn't called it a pandemic and so on. So it wasn't kind of reckless to travel. It was just that we didn't know that might be problematic. So I think from what you said, it might really be rather on the policy side to say that travel should be restricted earlier and so on. Yeah, I mean, you've just touched on something there to say, the WHO hadn't said, they said so. I think it was March 11 or 13th. I can't
sometime in March.
They announced it. Yeah. So before then, we're looking at China, Al Jazeera, BBC, CNN, everybody. I don't know the TV networks in Germany, but everybody is saying, look at China, people are dying, right? We, as the rest of the world, don't think, let's shut down. We wait for you to announce. There's a lack of responsibility there in terms of policy writers. So when it comes to, I wouldn't like to say common sense, but in terms of reaction, we were rather slow. Hence why, if you look at Italy, the death rate, shocking.
Yeah, totally.
And that's in Europe, And then you go all the way to Brazil, that was shocking as well. And they're still, trying to catch up in terms of what we've put in place, the measures. So I feel there's something there. And, in terms of maybe we need to reflect a little bit and not wait for the WHO to announce to say, well, close your doors.
So I didn't follow this too closely. I'm sure you're right with saying that there might have been kind of this responsibility diffusion between different agencies and so on. I also think that in future pandemics, if they are within our lifetime, we will react differently. All of us know that at the beginning of the pandemic, and this is also part of the effect we find, everything was normal. So we didn't know what a pandemic meant, right? We didn't know how long this would take, how dangerous this is, and how we should behave. So I think this would definitely be different if there's another pandemic in 20 years and we all know, okay, so this means shut everything down as soon as you can. And I think at the beginning of the pandemic, we at least if I remember for myself, we didn't know what was gonna come, and it was already crazy that there were less planes to China or so on, and then a few weeks later everything was shut down. So I think this might be different in a future pandemic just because people have already experienced one.
No, that is accurate. So going back to your research, you tested your hypothesis. Could you just take us through in terms of the testing that you conducted for your research?
Yeah, so we ran two studies. So we did one study for COVID-19 and one for the Spanish flu. That was about 100 years ago. And I will start with the COVID-19 one because I think it's a little smoother to follow, maybe. So we looked at the UK, the US, and Germany, and we started this study pretty early. So this was some of the only countries where we had comprehensive data on infection rates from different regions. And we looked at regional differences in median income, which means that like the median income of the people who live there. So if regions have higher median income, they're generally richer. And it just means that there are more people living there who are of higher social class and who have a higher income. And we compared the infection rates between those regions across time. So we looked at very beginning of the pandemic when we had a couple of cases a day only, and then how it rose, and then how that differed between different median incomes. So we looked at like higher median income, lower, and at least in the graph, you can see that there's like a different line for higher, lower, and median income. And what we found was that in all three countries, the infection rate rose much steeper in richer counties or regions. So it was like local authority districts, or in Germany, it just means smaller regions within each country. And within the richer regions, we had a steeper increase at the beginning of the pandemic. So this is very much in line with what we found, that once the pandemic is just kind of coming to the country, it's the richer regions are much more affected. And in the US and the UK, we found that after a few weeks, this turned around completely. So the richer regions went down and the poorer regions went up in their infection rates. And this was during the first wave. So in Germany, the first wave was contained very early, so just after a few weeks. And we believe that because of this very early containment, we never had this phase where poorer regions were more affected. So we only find that richer regions are more affected at the beginning, and then the wave is contained. While in the UK and the US, and especially in the US, it was much longer, the first wave. But I think in the US, it never really ended. So in the UK, it ended a few weeks after Germany. And we found that in the UK and in the US, there was very similar steep increase in richer regions at the beginning, and then it turns around, richer regions go down, there are almost no new infections, which is very few, and then in the poorer regions, they go up very steeply, and they just remain high until the wave is over, or if the wave is not over, until today, I guess. And this is, I think, very dramatic to see that the longer a pandemic keeps raging, the more it affects the poor regions and the poorer people, and that's very, I think, very sad, dynamic.
Sorry, I was just going to ask a question, which I think is important. Why did you pick France as well? Because the UK, the US, and France and Germany, they're like, what's the word I'm looking for? They're quite competitive in terms of money and finance and power. So why did you pick France?
The question is, so at the beginning, we only looked at the US, because in the second study, we also used the US data. But we decided that we wanted to do it, we wanted to replicate it in different countries. And we chose Germany and England because they have slightly different economic systems and healthcare systems. This was just basically because we wanted to have like a more liberal market system and a controlled liberal market system. And it was just basically, it was not like we didn't decide it from the other way around, like looking at all countries, which one should we pick, but just because we wanted to replicate it in a different system and wanted to see whether it replicates. I think we could do it for France too. It was just kind of outside the scope of the project, because it's always a lot of work to kind of gather all of the data and analyze it. So we thought that the three countries are already quite of a good combination of different systems. But we're also actually working on future projects at the moment. And one of the big questions is, how does it look at different countries? You said France, that's probably a pretty good choice as a country that's still pretty similar to the other three. But we also wanted to look at like very different countries, like poorer countries, or just different cultures, because they're all still pretty similar. They are all like Western and educated and industrialized. So it would be interesting to see whether we find a similar effect in other countries from other continents as well. Yeah. And this is something we're working on at the moment. So we already applied for a grant and got some funding for that. So I might be able to tell you something about this in a year or so, hopefully. We also want to look at future waves. So at the moment, we only looked at the first wave, and there are reasons to believe that we will find a similar effect in future waves, because a lot of things went back to normal. Like last July, August 2020 in Germany, you were allowed to travel again, and you could go to restaurants and so on. So it might be that people of higher social class are once again the ones who started the spread again of the second wave. But at the same time, it might not be the case. Like it's just as likely that the virus just stayed within each like stratum in the society, like all over the summer. So we never went back to zero, and it was still not allowed to travel internationally, and we still wore masks and had to get tested and so on. So it's really this is something I also think is very interesting to see whether it's only the first wave or whether it's the same effect in every wave.
No, I mean, that sounds interesting. As you were talking now, I was thinking India might be a great case study, because then they had their own vaccine and they were told, no, actually, even if you've had 2 doses of that vaccine, when you get to the country where you're going, you still need to isolate because we're not sure about your vaccine. And that's a world country. So I feel, not to use the word of disrespect, but, it was a bit disrespectful in that sense. And then the WHO then said, well, do you know what? No, it's perfectly fine. The Indian vaccine works, at the same level as the Pfizer, for example, and the Johnson & Johnson. So, in terms of that, I think it might be interesting. Maybe my wording is wrong, but it was something along those lines.
Yeah.
That would be interesting in terms of your research, and places like, for example, the DRC in Africa, because it's a war-torn country. Just understand what's going on there. So
I think it's very interesting. It's also I think South Africa was also a very interesting case, because it has a pretty big gap between richer and poorer people. So there's a lot, like, that's different to, like, Germany is pretty egalitarian. Like, there are of course regions that are richer and poorer, or people that are rich and poorer, but it's not like there's also a huge middle class. Like, it's not like either or, and that's different in like a lot of countries, like for example South Africa. And it would be interesting to see whether it's a similar effect, that like it's the upper class first, and then like how quickly does it change between the classes. And also like countries like, I think India was also very strongly affected, so that would also be interesting to see. And it's but it also depends on data availability, of course, because the countries need to be able to share COVID infection data from different regions, and also data on the income in different regions. So it's not easy to analyze all countries, because sometimes they just don't provide the data.
No, they don't. I know. In my own research. So go back to the swine flu then. What were the findings with the swine flu?
With the Spanish flu?
Yeah, with the Spanish. Where did I get swine flu? Spanish flu?
I don't know. This is also, I think, I really like the second study too, because in the first study, in the COVID-19 study, we look at regions. So we look at regional spread and at regional median income. And then in the second study, we wanted to look at individual level data. So we wanted to look there's no kind of statistical artifact, because we look at regions, but we wanted to look at, like, is a person that is richer or of higher social class, are they affected more at the beginning of the pandemic? And it's kind of hard to find data on the Spanish flu, because it was over 100 years ago, and there were no like registries or something, like no registers that wrote down, okay, this person died of the Spanish flu, and this was their job and this is their family and so on. So it's really, there's no comprehensive data on this pandemic. And we had this idea to use data from an online gravesite collection. It's kind of yeah, I've never, like, I haven't had contact to this kind of information before, but it's quite interesting. It's like people go around cemeteries and they take pictures of the gravestone, or they write down biographies or like obituaries about people. And this is, I think a lot of people are interested in their ancestry. So this is like, you can type in your name and you can see whether there are people buried somewhere across the US that have your same name or so on. So you can kind of track back your ancestry. And we use this data because they always put down the people's death year and birth year, and and the name. So even if there's no picture of the gravestone or so, but you can kind of type in people's names, birth year and death year. And that's enough for our study, because we looked at people who died during the worst wave of the Spanish flu, which was towards the end of 1918, I think. So we looked at our data, and we were able to see that from the general number of deaths that just happened, or that just recorded in this database every day during that time, it went up a lot during what we know was the second wave of the Spanish flu pandemic, or like the worst or the hardest wave of the Spanish flu pandemic. And so now we know who died during the Spanish flu, right? But then we also had to find out what their social class was. Yes. And to do that, we used their names. And there's some research that at least back then, people of higher social class gave more common names. So like William, for example, it's a very common name, and that was very, very prominent, or very common among people of higher social class, and was less common among people of lower social class. So we used their first names to calculate how common the name was that the person had during that time, because there's also there's a database provided by the US government that where you can check like how common, like how many people named their child this name in the birth year of the person. So we have the data on the birth year, and we're able to kind of give people a score on how common their name was. And we knew that higher commonness is also more likely to be of higher social class. And from the last name of the person, we were able to derive how likely it was that they were African Americans. And at least back then, there was a very minoritized and discriminated group. So we also know that, like, if you have an uncommon name and your last name indicates that you were likely African American, then it's likely that you were of lower social class. So this is kind of how we try to approach this question of the social class of people. And we think it worked very well. So we were able to find correlations of like how we estimated the social class of a region based on these gravestone data with the actual income and so on. And then we were able to find that for the Spanish flu in the US, we found the exact same pattern in our data. So at the beginning of the pandemic, more people died that were of higher social class, and then their death rate went down, and the death rate of people of lower social class went up rapidly and stayed high until the end of the wave.
Wow, that is amazing. I didn't know that you could do that. So I've learned so much today. It's like,
I mean, it's only approximated, so it's not, it would be like today we could ask people like, what's your subjective social class? What's your job? What's your education? How much money do you earn? But there's just no data on that from back then. So this is basically the best thing we can do. So this is the closest we can get to people to finding out what their social class is, or was, basically. And I think, I also was really excited about the idea, because it's, there's quite a lot of research on how like social status, but also cultural differences affect naming practices. And it was also interesting to get into this kind of research and read about it, because I think that's a pretty cool indicator. Yeah.
It really is. I mean, I've come to learn as well in terms of certain surnames in India. They mean a certain class, and it's quite interesting to see it from an American perspective and just looking at the history in terms of what's happened in America. So that's really interesting to me. So thank you so much for sharing. So in terms of your PhD then, what advice do you have for somebody who's looking to do something similar and date a postdoc? What advice do you have for someone who's thinking, I want to do a PhD, I've got so many ideas, but I don't know how to find, you know, the research gap that I need in terms of the things that I'm thinking of. What advice do you have?
So I think realistically, my advice is that at the very beginning of my PhD, I was in a similar situation, and I was like, oh, I'm interested in everything basically, and I could read for years, and I could, I don't know, go to conferences and listen to all the talks, but I wouldn't know where to start. And for me, it was very, very helpful that I had a very good advisor who suggested kind of a first idea to me. And I was able to like read up on it and think about how I wanted to get into it. But I think that's very helpful. Like, don't feel bad about taking your advisor's advice, basically. Yeah. So they have been in the research area for years, and they know like some gaps. And from my experience, if you just get started with one first project, you will realize that there's so much more to do in the area, and that makes it much easier to identify. Like you're like, this is like this study that we talked about. This was, as I said, just like really. Like I was already in my PhD for a while, and I had some idea about how social class affects behavior, and that pandemics, like we were in a pandemic. So this is how I came across this idea. But generally for your PhD, I think it's very helpful to just get started with one project. And then while you work on the project, you read up on the literature and you realize, okay, there's this other thing that I also find very interesting. And then you can get more into that. But I think what I've witnessed from other PhDs as well, or PhD students as well, it can be really hard if you don't have any starting point. Like if you have the starting point, you can still adjust to your interests and you can still adjust to new ideas. But if you don't have a starting point, it's really like, I know that most PhD students are very excited about everything and they love research. So they really, at least from my experience, it's really helpful to just have one project to start with. And then once you're in it, you can always like take side paths or adjust it. Yeah.
No, that's brilliant. That's brilliant. So in terms of future then, are you planning to go on to your postdoc, or are you thinking, I want to go and work? What are your plans?
It's a good question with work. So no, I still want to work, but I want to work in academia if possible. Yeah. So I really enjoy research. I also love teaching university students. So it's really, I think it's a great job. I love thinking deeply about things. So it's really, I think it's a very attractive job. It's not a very secure job. I think that's very different. Like it varies between countries, but I don't think there's any country where staying in academia is a very secure and easy path. So I would love to at least try it. I will definitely do a postdoc and see where it goes from there. I'm kind of open to see where it will take me in the next couple of years. But I'm trying to do what I can to get a position in academia.
That's amazing. So thank you so much in terms of your time. So to everybody out there, don't forget to like, share, subscribe, and share with everybody out there in terms of our YouTube channel. So in terms of myself, my name is Norma. Thank you so much for your time again and joining us on PhD Hard Talk, Jana. So in terms of the new hashtag, it's now #project dissemination to the world. So ensure you share all these conversations so that we can educate the global community. I mean, this is amazing what we've discussed today in terms of COVID-19 and the spread, in terms of the upper class going on to middle class and lower class, and the repercussions of, our behaviours in society, in a sense. So thank you so much for your time, and I wish you well in terms of your future endeavours. Thank you.
Thank you for having me.